Hi everyone, I am the mass scientist, and today we're talking about the first of its kind therapy that has saved a child from death. In a medical first, researchers delivered an enzyme into the womb to treat a rare genetic disorder called Pompe disease. Now, the child who cannot make the enzyme on her own is alive and well at almost 2 years of age. Unfortunately, her two siblings who also had this genetic disorder but did not have this therapy has died from the disease. Now, the original report was published in the New England Journal of Medicine, which is a proof of concept work that highlights the potential benefits of prenatal enzyme therapy. So what does this mean? It means we can deliver an enzyme straight into the womb when the baby is developing, and this can actually cure the child of certain diseases. Pompe disease can occur when a child inherits the defective gene for an enzyme that breaks down glycogen, which is a form of starch. If glycogen doesn't break down, it can build up in muscles and cardiac cells, which will eventually lead to heart failure. And this heart damage can even start when the fetus is still in the womb of the mother. Now, pediatric surgeon Tippy McKenzie and her team at the University of California, San Francisco wondered if they could infuse the enzyme right into the umbilical vein and if this would protect the fetus from Pompe disease. According to McKenzie, this was an area of research that has been overlooked for some time. A couple of years ago, these scientists tested this approach in mice, and the success of the enzyme infusion treatment really encouraged them to start a human trial. And this is where they enrolled a couple from Canada who had two healthy children but ended up losing two girls to infantile onset Pompe disease. Knowing this, when they had their next child, they then started to administer the enzyme 6 times starting at 24 weeks of pregnancy. And since this treatment, baby Ayla was born and showed absolutely no signs of heart problems that are oftentimes seen in infantile onset Pompe disease. And Ayla has been developing normally. The parents have been ecstatic and called this an absolute miracle.